Hundreds of thousands of people have lost their life in the U.S. to an opioid overdose in the past decade. But there's one medication that could change that. I'm Kathryn Bruch, and coming up on WVU News, I'll take you to an event handing it out for free. Coming up on WVU News, in the year 2019, the WVU Rockefeller Neuroscience Institute launched a first-of-its-kind clinical trial. I'm Kathryn Bruch, and I'll tell you about how deep brain stimulation can help patients with opioid use disorder. Lace up your running shoes, because coming up on WVU News, I'm Kathryn Bruch, and I'll take you to the Shack Quacks 5K fundraising event right here in Morgantown. Coming up on WVU News, just 4 years ago, eggs used to be $1.40, which now range to be $3 to $5 due to inflation. I'm Kathryn Bruch, and even though inflation rates are now declining, prices on groceries still remain high. This event on WVU's campus had 2,000 doses of Narcan available in 3 separate locations, and organizers say they're easy to use. Take the spray out of the box, remove the packaging, and place your thumb on the bottom to disperse the medicine into somebody's nose, just like an actual allergy spray. This type of treatment is not just a simple visit to the doctor's office. As you can see here, the doctors are inside the patient's brain, implementing a Medtronic DPS device in the addiction and reward center of the brain. According to the USDA Thrifty Food Plan, in December 2022, the average cost for a family with just 2 kids came out to be $971.20. According to the nation's report card, the average 4th grade student for West Virginia's literacy score was 226, which is lower than the national score of 235. Coming up, we'll celebrate people who are staying in long-term recovery. WVU News will have those stories and more on our special edition show, Addiction in America, an Ongoing Epidemic. A new law in West Virginia will allow students to carry guns on campus. And now, the WVU community is speaking out both in support of and against it. According to the World Health Organization, as many as 23 million people have been impacted. More than 1 million of them are children. People across the globe are raising money to help. And recently on WVU's campus, a group of students and Morgantown residents gathered in remembrance of the lives lost. During National Black History Month, we celebrate the legacy of Black Americans whose power to lead has helped our nation become a more fair and just society. And Maggie, insulin is among one of the most expensive of those drugs. The prices have increased by 600% the past 20 years, but these costs will soon be coming down. The train derailment in East Palestine, Ohio is being called one of the worst environmental disasters in history. West Virginia's 2023 legislative session is over, and now people across the state are taking into account what has passed and failed. According to the Substance Abuse and Mental Health Services Administration, engaging in social activities can help people in recovery maintain their sobriety because they join a community of support. The WVU Rockefeller Neuroscience Institute and WVU Medicine are conducting a first in the U.S. clinical trial that uses deep brain stimulation for treatment-resistant opioid use disorder. What you are watching here is groundbreaking. This brain surgery is the first of its kind to help people with addiction. Dr. James Mahoney works with patients participating in this groundbreaking clinical trial, but says recruiting patients with an opioid use disorder for such a serious treatment can be difficult.
Of all aspects and what's going to be required of them, it is a very intensive study. It's brain surgery, so we need to make sure that they're very well informed and understand what they're getting into.
This type of treatment is not just a simple visit to the doctor's office. As you can see here, the doctors are inside the patient's brain, implementing a Medtronic DPS device in the addiction and reward center of the brain. The procedure has enabled 3 out of 4 patients that underwent surgery find long-term recovery. Now doctors are recruiting 20 more participants.
One of the things that we've learned is it's not just flipping the addiction switch. It's really meant to help individuals maintain success with the standard level of care.
Studies found this treatment can make people with substance use disorders less likely to relapse and have a better quality of life. Clay Marsh, Executive Dean of Health Sciences, says it's one more way WVU is a leader in the addiction science space.
So we are trying to pioneer treatments and new approaches, but we're also pioneering caring and making sure that people have access to high, degrees of training and education.
The clinical trial at WVU was approved by the FDA, and now more hospitals across the country can offer similar treatments to help people find long-term recovery.
3 of these fentanyl test strips.
Naloxone is a medicine that, when used quickly, could reverse an opioid overdose. Jamie Moore says easy and quick access to it could mean the difference between life and death.
It's very important that everyone, that can get Narcan, that they get it, they learn how to use it, they have it available for whenever they come across the person who needs it, and they utilize it to save a life.
There was free fentanyl test strips at the campus event targeting students. Fentanyl is a synthetic opioid 50 times stronger than morphine, and the CDC says it's responsible for a majority of overdose deaths in the U.S. in 2022. This event on WVU's campus had 2,000 doses of Narcan available in 3 separate locations, and organizers say they're easy to use. Take the spray out of the box, remove the packaging, and place your thumb on the bottom to disperse the medicine into somebody's nose, just like an actual allergy spray. Craig Harsh is part of the West Virginia Peers program, which helped train students on the use of Narcan.
Also provide peer support, which is where people like us that do have our own history of substance use disorders can provide a judgment and stigma-free person to talk to.
Although the federal government doesn't track national numbers, some states report more than 45,000 lives have been saved by naloxone in a single year. Kathryn Bruch, WVU News, Morgantown.
145.
While prices on some items are going down, groceries aren't among them. Mary Hinchliff is a mother of 3 and says she spends between $300 to $400 a week on groceries for her family, and the cost is changing how she shops.
Families are going to be budgeting differently for food, and I think they're buying food differently. Or like I said, I used to buy a lot more perishable, a lot more organic foods. I don't do that anymore.
Food items such as eggs, butter, and milk have increased by $2 or $3 since 2019. According to the USDA Thrifty Food Plan, in December 2022, the average cost for a family with just 2 kids came out to be $971.20. Brian Lego is a professor and an economic forecaster at WVU. He says family grocery bills are affected by more than just the cost of the food itself.
The packaging, whether it be the labor, whether it be the transportation, all these things factor into the final price the consumer sees on the shelf.
Those costs are impacting Hinchliff too.
It doesn't feel like inflation has gone down for me, and a lot of people I've talked to have said the same thing. And part of the big thing is it's costing us just as much to get to the grocery store.
These price hikes are also impacting family pets, as U.S. pet food inflation has hit a new high of 17.7% year over year. Kathryn Bruch, WVU News, Morgantown.